mean, it's unbelievable.
Yeah.
Oh no, they ignore it. It's honestly like they don't want anything simple, especially something simple, cheap, and non-toxic.
We were just chatting about this before we came on air, weren't we? The idea that there's so many basic, simple things that could be done. So making everyone vitamin D replete, optimizing. One example we were talking about was iodine. In Japan and Korea, they eat seaweed, which is high in iodine. They have low rates of breast cancer, and there's mechanisms that whereby this would make sense. We don't eat seaweed in England and the United States. We have very low amounts of iodine, but we have very high amounts of breast cancer and other glandular cancers. I think it has to be said.
Yes,
pancreatic cancer, prostate cancer.
Yeah, adenocarcinomas of any origin.
Do you think iodine is a factor in all of those?
I do. It's one of the others on my list of looking at great detail, and I have been looking at it, and I think that the evidence for supplementing it used to call Lugol's iodine, wasn't it?
Yeah. I take Lugol's 15%.
Right, and the evidence for that actually is enormous, and would be the next one I would add to this list of prevent you deteriorating, getting cancer. So I'd make it the fourth thing after vitamin D, the iodine, LDN, and then the iodine.
Because if you think about it, hunter-gatherers, the reason that we spread around the world was on the seashore. And what do you eat? You eat limpets, you eat shellfish, you eat seaweed, and fish if you can catch it. That's the way we kind of. One of the main ways we spread around the world. I'll just tell you an interesting story. I'm quite naughty, really, and I've been going into chemists lately asking for iodine, and because you can't buy Lugol's iodine in British chemists, and this is completely true. I went into a well-known high street chain of chemists, and I said to the assistant, "Can I have some iodine, please?" She said, "Oh, I don't know about that." She went to get the pharmacist. I said, "Can I have some Lugol's iodine?" And this is a completely qualified pharmacist. She said to me, "What's that?" I couldn't believe it. And I went into another well-known high street pharmacy recently, and I said, "Can I have some iodine, please?" She said, "Oh, we haven't got any." "I'll get the pharmacist." I said to the pharmacist, "You don't have iodine, do you?" He said, "No." I said, "Why not?" And the pharmacist said, "Oh, I don't know. Maybe people have been abusing it." You can imagine all these people having iodine parties getting stoked up on iodine. It's just preposterous. Basically they didn't have a clue, and these are the pharmacists that are supposed to be guiding the drug use of the entire country. And the old saying was, "If you know not the where, when, and why, give you then the K and I." It's what we used, up until about 1910 or whatever. That was all doctors would do that, and now the pharmacists haven't even heard of it. Sorry, it's difficult not to get emotional about these things. It's so absurd.
You're talking to the right person. I've been through all this so often.
So absurd. Yeah. And
I'm not going to mention it because it deflects from this, but there was something else that I wanted for a patient that it occurred to me would be very, very useful, this drug. And I went to this is what reminded me. I went to the chemist and I said, I'd like an oral version of this drug. I've heard that it does exist. And the chemist said, "Oh yes, it does. It's very, very good. But we're not allowed to prescribe it." As a chemist, and then he told me to go to a certain health food shop and to ask specifically for the head person and to ask for the drug, and he wanted it orally, and that I had been sent by the chemist.
Oi! I know a mate in the pub down the road. Just ask him. He's got some under the counter, mate. Slip him 20 quid and he'll give you one. It's like underground porn or something, isn't it? It's and this really serious point that comes from this, Gus, is we've talked about D3. Okay, easy enough to give yourself D3. Naltrexone a little more difficult to get. Iodine certainly possible to get. The IMM 101 unfortunately not possible to get. But the problem is, because these treatments, the evidence that these treatments and other things that we could talk about, other repurposed drugs that we could talk about, mebendazole, fenbendazole, ivermectin. Is it methylene blue? I'm not sure. I'm not advising people take any of those, of course. We don't give medical advice. But the point is, because so many of these treatments, there's so many repurposed treatments and new treatments that are turkey tail mushroom.
Yes.
You know, there's so many that have got so many anecdotal reports. You know, if you ask 100 people, there's probably one that knows someone who believes that their cancer has been taken away, you know, gone into remission with these things. That people are taking medicine into their own hands. And they shouldn't have to do that. You know, the precise dose of the precise preparation should be given to them by their doctor, but by the same route. And it's actually quite dangerous, I think, that people are taking medicine into their own hands now out of sheer frustration.
Yes, it is sheer frustration.
With orthodoxy and desperation. You know, I get emails every day from desperate people. And they're begging me for medical advice, and of course I can't give it because I don't know them. And it just seems a tragic situation that these simple things are there, they're available, they're known, and people are taking medicine into their own hands out of sheer frustration. And it also seems to me that doctors like yourself with 50 years experience, probably, you know, you're a professor of medicine. You know, the idea that you can't prescribe what you want, when the heck you want to, who the heck you want to prescribe it to, just seems outrageous. You know, because who knows better than someone with a lifetime experience in academic medicine? It's just. Well,
I must say, I find this really frustrating that we've got to this situation. There's just so much unnecessary overall management that stops me from doing things that I want to do that I know well. A very good example is that, and I realised the checkpoint inhibitors were very useful in certain things. I had an understanding of the immune response and what patients might be useful. I was allowed to prescribe it for stage 4 melanoma when it was approved. And I found that there were some other cancers that had similar characteristics that I think would benefit from this. Oh, not allowed. It's not being approved for that trial. And then I could say, I had to remind them, I said, you know, I have my right to do it off license, and you've got to allow me to do it. And they gave me all the warnings and stuff. You can be reported to the GMC. I mean, what is that? This is why.
You're actually threatened.
You're threatened.
Yeah.
But I said, no, I really want to do this and I take full responsibility, etc. And that's when we first started to see that other cancers started responding to these things, and one of them was lung cancer, because we knew from MVACI work that melanoma and lung cancer had some similarities. It was the immune response, and so now these patients, they said, I'm not allowed to do, even if it's off license, but it's in the hospital, they're not going to allow me this, that and the other. Now, several years later, these drugs are all approved for the very things that I was wanting to do. So anybody who tries to lead the way is basically just like a Monty Python foot stamped on.
Yep. People of a certain age will remember the Monty Python foot. And I mean, it's a side point, but while I'm having a bit of a rant, working in organisations these days is intolerable anyway. You have to subscribe to so many political doctrines. You know, it's just, and you have to attend so many courses which are basically political in nature.
I'm afraid that's absolutely the national health service has been destroyed by this dogma. And
the higher education. We won't go into it, but because we want this video to go on air. But you know, it's a culture where people are conformity is demanded, and there's been previous cultures where conformity is demanded. You know, you will make this particular salute. You will click your heels. You know, or you will say yavul. You know, we've been here before, and people just don't seem to see the dangers.
The similarities. I can see George Orwell behind you.
Oh, yeah.
What vision he had.
Yeah.
Because we are now in a dystopian world, whether you like it or not. the infiltration's been at the very, very top.
Yep.
It's now looking at what went on with COVID.
Yep.
This came from the very, very top. United Nations, WHO, all these things, Gavi, CEPI, they were all set up to basically push for a pandemic, which I believe if they hadn't have done all these things, we would never have suffered. This is the madness of the whole thing.
Yeah, and in fact, even there might be a layer above the layer that we know about. This top-down control.
Well, the world
everyone knows now what they're not allowed. No one's written me a list of things saying, John, you can't talk about this, you can't talk about that, you can't talk about the other. You just know. There's a whole list of things you can't talk about, largely because people have been in prison for it and persecuted for it in various ways. And I really, really resent the self-censorship I have to work under. It's anyway, it's a separate rant.
But it's true, and it's my thing is, you're not allowed to do that.
Yeah,
I'd like to use this drug and that drug. There's no evidence. I mean, it's totally negative. And I will say that when I first went out, before we really had much useful treatment, I said, why don't we do this, that, and the other? And they'll go, well, that's a good idea. Right, try it, but make sure the patient knows it's not normal, and that they're fully informed, and we do it, and then things would work. And I was reminded that the great chemotherapy we had for Hodgkin's disease, that didn't ever come through big randomized controlled trials. No, it went with what I've been campaigning for to go back to, is adaptive trials. So the guy, I think Mike Peckham, who was the head of radiotherapy, interestingly, who actually ended up doing these chemotherapy studies, you start with one drug, well, that worked quite well, but not well enough. Let's add another one in. Let's add another one in. Oh, there's some side effects. So we had to add a drug in for the side effects. I think it's dexamethasone. Oh, that works far better than anything else. Leave it up.
It's just evolution, isn't it?
It's evolution. And that's
it's a biological evolution.
That's how we should be practicing medicine. Yeah. And you don't need big randomized trials, I believe.
Incremental improvements.
Incremental improvements, and then you do your randomized study, as it were, as I mentioned with myself with this agent.
Yep.
You see if it works for the patient, and if you withdraw it, do they relapse, put it back in, do they get better? I mean, what bit do these guys not understand?
Yeah.
Well, I'll tell you what they do understand is that unless it's all been done in this way, then it's not going to be approved, not allowed. Why is that? It's because Big Pharma have hijacked the regulatory authorities, and they've hijacked education. The doctor's education is all hijacked by Big Pharma now. Yep. I think the medical schools are a disgrace. They're not educating people. They are training technicians in particular jobs.
Yep.
You don't get this broad expertise as to how to treat and look after patients better.
It's called assess, plan, implement, evaluate, and then that evaluation feeds through into your next cycle of assess, plan, implement, and evaluate. It's so simple. I actually went to see well, I'll be careful what I say, but I went to see a very senior doctor for a particular issue. Well, it's for a prostate issue. And I said, I've been taking zinc and vitamin D. I think that probably helps. And this very senior doctor said to me, oh, I don't know about that. He just follows the nice guidelines. You know, the idea that you wouldn't want to make your vitamin D and zinc replete in anything to do with the prostate, and yet not on the guidelines, not interested. It's called curiosity deficit disorder.
Yes, that's a good. I've not heard of that before.
It's a virus, yeah. So it blocks the curiosity receptors in the brain, and it's spread around the entire world. So everyone's curiosity ligands can't get into the postsynaptic neuron.
Yeah.
So everyone's going around with this zombie-like curiosity deficit disorder. Duh. I don't know, mate. I
That's
just
the way-
follow the
way-
guidelines.
when I refer to the medical school and how they are just indoctrinated and inculcated, they're not being taught to think. I one of my last lectures I gave, where I gave up exasperated talking to the medical students, was I was telling them about a particular mechanism, and which is what they want to know. And then I said it's very similar to this other mechanism in the other pathways and things like that. So one way of looking at things is to see similarities when only differences appear, and vice versa.
Which is a Bradford Hill criteria analogy.
Is a way to think. And this student in the front row, so one of the writing away everything, put up, "Please sir, we don't need to know this, it's not in our curriculum." And I thought, if that is what university has descended to, why bother? Why bother going to university? Why not just read the thing and do the multiple choice, and not bother talking to people like me wanting to expand their minds and teach them how to think? They weren't interested.
And the arrogance of thinking that your lifetime in medicine is of no value to them is just insulting.
Yeah.
Yeah. So, I mean, I could keep you talking all day, but just, I mean, when you first went into clinical academic medicine, and you're a practicing physician, and you're able to instigate these things.
Yes.
I mean, what is the difference? How much more freedom did you have then than you have now?
Far, far more then. I really did. I mean, if you were even as a registrar, providing my consultant degree, I tried lots of what I would call bespoke treatments for people's conditions. And I was allowed to. There was no inhibition, unless the consultant might say, "I think this guy's a bit out of order. Tell the pharmacist, only if I agree." I never had that, and that was wonderful. Then, as a consultant, I was able to do exactly what I thought, and I was a general physician for 5 years, as well as being immunology doing cancer. So I saw everything. And I mean, talk about repurposing. Actually, one of my proudest achievements was repurposing a chemotherapy for very, very serious arthritis. And the person had hypertrophic pulmonary osteoarthropathy, which is what it is, a horrible arthritis due to hormones produced by lung cancer. At the time, the chemotherapy for lung cancer was not approved, as there was no evidence that it worked well. It was that long ago. Then slowly we started getting some evidence, but anyhow. So I said to the person, "We know that this big tumour you've got, which had already had radiotherapy, and the cancer surgery was no longer an issue possible." So I said, "The arthritis we actually know from papers is produced by a hormone being produced by the tumour. Why don't we give some chemotherapy to the tumour, not on the grounds we're going to cure the tumour, but if we can dumb it down so it stops producing that hormone, perhaps the arthritis will improve."
It's kind of a paraneoplastic effect, isn't it?
Yeah, paraneoplastic effect. So I discussed it with the patient and said, she couldn't even go to the toilet herself, so that's how bad the arthritis was. Horrible, horrible. Any rate, I discussed it with a consultant physician elsewhere, because I was basically operating as a consultant at the time, but not in that area. And then he kind of said, "Well, go for it, see." The pharmacist approved it. We gave her the chemotherapy. And 3 days later, when I did the ward round, she jumped off the bed, came up and gave me a wonderful big cuddle.
Not surprised, It
worked. Even I was surprised at the extent of which it worked. But so that type
that's just because you're using your intuition, your tacit medical knowledge that you were allowed to do in those days.
Yes, but now you wouldn't be able to do that.
So you just leave your patient in bed suffering.
Yeah, exactly.
Right, well, while we're still sane, Professor, thank you so much as always.
Thank you.
Low dose naltrexone, LDN, it's going to become universal. It's just a case of how many people suffer till it becomes standard. And unless, of course, Big Pharma win and they get it banned like other drugs that could be mentioned. But, I guess the battle's on. But we've done our bit. We've spread the information that you've developed over decades, and We really appreciate it.
And if I could just point out, there are some books on LDN. From
I must get that.
The LDN Trust. There's now 3 of them. I confess I have contributed to these.
Yep.
But I'm staggered.
Have we got links for those, Gus?
There's 3 of them. Yes, the LDN Trust website has it.
Oh, right. LDN Trust website, right.
Yeah. And I am staggered that the amount of research that's been done in other conditions, particularly neurological.
Interesting.
I mean, there's really fascinating benefits, and I've given it to a cancer patient who had Parkinson's, and the Parkinson's improved, and they've been on Parkinson's for ages, and they said, and it's actually in that there are people working on the mechanism. So, how, with all these other people so interested and excited by it, it's even more amazing that people, the vast majority of doctors, say low dose naltrexone, never heard of it.
Yeah. and of course, anything that we can use to reduce inflammation that's not a steroid is a good thing. I mean, the amount of people that quietly die from pneumonia on steroids, and it's never attributed. I'm sure it's in the thousands.
And of course, the non-steroidal anti-inflammatories, they're all besieged with gastric problems. Yeah. Low dose naltrexone has none of that. Yeah. And it's just so it's really unique. That's because it targets this totally different pathway.
And targets many different pathways, including altering gene expression, which is just amazing. Amazing interaction between a simple molecule and this amazing system of emergent complexity that we are. Professor, thank you so much as always.
Thank you. Bye.
Bye.